I'd say over half of all adults are pre-diabetic or
Right
diabetic.
now.
Right now.
So it's not even like something predicted. It's like 1 in 2 people have pre-diabetic.
Yeah. So in the U.S., it's 60% of all adults, and I'm sure Canada's right there, are pre-diabetic or outright diabetic. Those are similar numbers in India, similar numbers in China, the two most populous countries on the planet. Mexico, the Middle East, and the most diabetic countries as a percent of population are in the Middle East, and then Mexico, Southeast Asia are right behind it. I mean, it's all over the world. It really is. It is the most common disease in the world, pre-diabetes, type 2 diabetes, and it's all because it's an insulin problem that we aren't diagnosing it more readily. We're looking at glucose as the marker. We're missing it. Insulin can be elevated 20 years before glucose changes.
It's actually kind of interesting, like you ask doctors to measure your insulin level, and they're so hesitant.
Well, they look at you like you have two heads. What are you talking about? We know your glucose levels. We don't need your insulin levels. And the more I talk to doctors, the more sympathetic I am, because they're not trying to be difficult. We're taught that. We only know what we've learned. And we learn through being taught or teaching ourselves. And a physician does not get paid to learn. As silly as that sounds, they get paid to see patients. I'm a scientist. I get paid to ask questions. I get paid to be curious. It doesn't pay very well, but being curious has perks, which is I find answers to questions. And then my only hope is that the answer that I can pass on to someone else, like you guys, hopefully like a bunch of physicians, that there's someone who can take what I've learned and make something out of it. That is deeply gratifying to me. And I trick myself into thinking it's happening.
And
I believe it is.
and that. Sorry, go on. I was going to say, and it's not the physicians that are going to change the world. It's going to be the layman. It's going to educate their family, and that's what's going to change the world.
Yeah. The small little person-to-person changes is the best way to do it. One person who's been convinced, converted, seen the reality of the situation, telling it to their neighbor. That's the way to do it, one-to-one.
Yep.
Just like you guys are doing.